When most people hear the term Kegel exercise, they immediately associate it with women, especially during pregnancy or postpartum recovery. However, what many men don't realize is that Kegel exercises are just as important for them. In fact, these simple, discrete exercises can help men strengthen the pelvic floor muscles, improve bladder and bowel control, enhance sexual performance, and even help with erectile dysfunction (ED). Despite their effectiveness, Kegel exercises are often overlooked by men due to lack of awareness or the misconception that they are only for women. But medical research and urological specialists strongly encourage men to incorporate Kegel exercises into their daily routine, particularly as they age or face urinary and sexual health challenges. This article explores what Kegel exercises are, their benefits for men, how they can address problems like urinary incontinence and erectile dysfunction, and step-by-step instructions for performing them correctly. By the end, you'll understand why more men should add Kegels to their daily lifestyle. Kegel exercises are simple muscle-strengthening movements designed to target the pelvic floor muscles, a group of muscles and ligaments that support the bladder, bowel, and sexual organs. The pelvic floor muscles act like a hammock, stretching from the pubic bone in the front to the tailbone at the back. They play an essential role in controlling urination and bowel movements, supporting erections and ejaculation, maintaining core stability. Just like any other muscle in the body, pelvic floor muscles can weaken over time due to aging, obesity, surgery such as prostate surgery, chronic coughing, or lifestyle factors. Weak pelvic floor muscles in men can lead to urinary leakage, reduced sexual stamina, premature ejaculation, and erectile dysfunction. Kegel exercises strengthen these muscles, improving both urinary control and sexual health. The best part? They can be performed anywhere, sitting, standing, or even lying down, without anyone noticing. While Kegel exercises are commonly recommended for women, men have just as much to gain from practicing them regularly. Let's explore the primary reasons why men should adopt this powerful yet underrated exercise. 1. Improve urinary incontinence. Urinary incontinence, leaking urine, is one of the most common issues men face, particularly after prostate surgery or as they get older. Types of incontinence include stress incontinence, leakage during coughing, sneezing, laughing, or lifting. Urge incontinence, a sudden and intense urge to urinate, often linked with overactive bladder. Post-void dribbling, leakage just after finishing urination. Kegel exercises strengthen the muscles that control urination, giving men better bladder control and reducing embarrassing leaks. Studies show that men who perform Kegels regularly can experience significant improvements in continence, especially after prostate surgery. 2. Reduce erectile dysfunction (ED). Erectile dysfunction is the inability to achieve or maintain an erection sufficient for sexual intercourse. It can result from poor blood flow, nerve damage, or weak pelvic floor muscles. Kegels help by strengthening the bulbocavernosus muscle, a key pelvic muscle that helps pump blood into the penis during erection, aids in ejaculation, assists in emptying the urethra after urination. By improving blood flow and muscle control, Kegel exercises can naturally enhance erection quality, making them an excellent complementary treatment for ED alongside medical therapies. 3. Enhance sexual performance and stamina. Men who want to improve sexual performance can benefit greatly from Kegel training. Stronger pelvic floor muscles allow better control over ejaculation, helping reduce premature ejaculation and increasing endurance during intercourse. Some men also report experiencing stronger, more intense orgasms as a result of regular pelvic floor strengthening. 4. Post-prostate surgery recovery. Men who undergo prostatectomy, surgical removal of the prostate gland due to prostate cancer or other conditions, often experience urinary incontinence and erectile dysfunction. Doctors often recommend Kegel exercises as part of post-surgery rehabilitation. Studies show that men who start Kegels early after surgery regain bladder control more quickly and may also improve their sexual recovery outcomes. 5. Preventative health benefits. Even if a man doesn't currently suffer from urinary or sexual health problems, doing Kegel exercises regularly can serve as preventative care. By maintaining pelvic floor strength, men may avoid developing issues later in life, just as exercising other muscles helps prevent weakness and injury. How to identify your pelvic floor muscles? Before you can perform Kegel exercises correctly, you need to locate the right muscles. Here are 3 reliable methods. Stop urine midstream. Try to stop urinating mid-flow. The muscles you engage to stop the stream are your pelvic floor muscles. Note, this should only be used to identify the muscles, not as a regular exercise, since stopping urine mid-flow can harm bladder function. Tighten as if preventing gas. Imagine you're trying to avoid passing gas in public. The muscles you contract to hold it in are the pelvic floor muscles. Mirror check. When you contract the correct muscles, the base of the penis may lift slightly, and the scrotum may rise. You should not see your abdomen, thighs, or buttocks tensing. If they are, you're using the wrong muscles. Now that you've identified the pelvic floor muscles, let's walk through the correct technique for doing Kegel exercises. Step-by-step guide. Get comfortable. Start in a comfortable position. Lying on your back with knees bent can make it easier for beginners. Later, you can progress to sitting, standing, or even doing Kegels while walking. Contract the pelvic floor muscles. Tighten the muscles you use to stop urinating or prevent passing gas. Hold the contraction without squeezing your buttocks, thighs, or stomach. Hold the contraction. Hold the squeeze for about 3 to 5 seconds while breathing normally. Relax. Release the contraction and rest for the same amount of time, 3 to 5 seconds. Repeat. Perform 10 to 15 repetitions in one set. Aim for 3 sets per day, morning, afternoon, and evening. Just like other muscle groups, the pelvic floor can be trained progressively. Longer holds. Gradually increase the hold time up to 8 to 10 seconds. Quick flicks. Do rapid contractions and relaxations to improve muscle endurance and control. Combine with breathing. Exhale as you contract and inhale as you release. Functional training. Use Kegels before activities that might cause leakage, like coughing or lifting weights. Many men perform Kegels incorrectly, which can reduce their effectiveness. Avoid these mistakes. Holding your breath, breathe normally throughout. Using the wrong muscles, don't contract the abdomen, buttocks, or thighs. Overdoing it, muscle fatigue can worsen symptoms. Expecting instant results, it may take 4 to 12 weeks to notice improvements. Patience is key. Just like strength training at the gym, results don't happen overnight. Most men notice improvements in bladder control and sexual performance within 4 to 12 weeks of consistent practice. For those recovering from prostate surgery, it may take longer, but daily Kegels can significantly speed up recovery. Numerous clinical studies highlight the effectiveness of Kegels. Research published in the British Journal of Urology International found that pelvic floor muscle training significantly improved erectile function in men with ED. Studies on men post-prostate surgery show that Kegels accelerate the return of urinary continence. Experts in sexual medicine recommend Kegels as a non-invasive, cost-free, and side-effect-free method to enhance men's health. While Kegels are safe for most men, some may struggle to identify or engage the correct muscles. In such cases, consulting a pelvic floor physical therapist can help. They use techniques like biofeedback or electrical stimulation to guide proper muscle activation. If symptoms of incontinence or erectile dysfunction persist despite regular practice, it's important to consult a urologist to rule out underlying conditions such as prostate enlargement, nerve damage, or vascular disease. Set reminders to practice daily. Pair Kegels with daily routines, e.g., brushing teeth, watching TV. Be consistent, treat it like brushing your teeth, a lifelong habit. Combine with healthy lifestyle choices like losing excess weight, exercising regularly, reducing alcohol, and quitting smoking to maximize results. Kegel exercises are a simple yet powerful tool for men to take control of their urinary and sexual health. By strengthening the pelvic floor muscles, men can reduce or prevent incontinence, improve erectile function, enhance sexual performance, and support recovery after prostate surgery. The best part? Kegel exercises require no special equipment, no gym membership, and can be done discreetly anywhere. All it takes is a few minutes a day, and the results can transform your quality of life. So, whether you're dealing with incontinence, erectile dysfunction, or just want to stay ahead of potential problems, Kegels are worth adding to your routine. The earlier you start, the stronger your foundation for lifelong health and confidence.